Hi, everybody. Welcome to Cox Connections. Brad Grundmeyer, Director of Public and Government Affairs for Cox, Louisiana. Thank you so much for tuning into this segment. What we're going to talk about today is something that's really important. You might not be aware, but May is actual National Stroke Month. And what we're trying to do is get you information in regards to that, kind of dispel a little bit of the myths. Let me give you some interesting statistics. Of 795,000 Americans will have a new or recurrent stroke this year, and more than 137,000 of them will die, unfortunately. In fact, black account for 33% of all deaths among blacks in the United States, and this is all according to the American Heart Association. So good information, but for this one, we're just going to give you, hopefully, the tools to put in your tool belt to equip yourself to be able to recognize and notice the signs, and also differentiate, but maybe between what is a stroke and a heart attack. So we're going to talk all about that. Of course, happy to be joined again by Ms. Sheryl Martin-Schild, who is a doctor of vascular neurologist, at Tulane University Health Science Center. Good to see you. Welcome back again.
Thank you very much.
You decided to come back. I was joking earlier, but I'm glad you came back. Thank you so much.
I appreciate the opportunity.
As always. So May is National Stroke Month. Tell me a little bit about that.
Well, it's a movement to increase awareness in not only stroke risk factors, but stroke warning signs, and the awareness that there is treatment for stroke and that treatment is time sensitive.
We always hear a lot about cardiovascular disease. Obviously, it continue, I guess, on the rise too as well, correct?
Yes, risk factors for heart disease are basically the same risk factors for stroke.
And what is amazing, I was reading another statistic that was in here, is that there are two types of strokes. Please tell us about that.
There's actually three types of strokes. There's the kind where there's a clot or an obstruction within a blood vessel, and there's disruption or reductions in blood flow to a part of the brain that serves a specific function. We call that an ischemic stroke. And
that counts for the majority, right?
That's about 85% of all strokes.
And the other two?
Then there's hemorrhagic stroke, which is when a small blood vessel breaks inside of the brain and causes a blood clot to form within the brain tissue, disturbing the way that it functions. The most common cause for that is hypertension. And then there's subarachnoid hemorrhage, which is when generally an aneurysm or malformed blood vessel has a rupture and there's bleeding around the brain.
Amazing. And what I find is really interesting, these all sound so tragic and scary, but the good news is that stroke is largely preventable.
Stroke is largely preventable. It's also improved in terms of the treatment. It dropped from the third leading cause of death to the fourth leading cause of death, largely due to advances in neurocritical care. But it's still a major killer, and it's the #2 killer of black women.
Really? And that's just so unfortunate to hear. And but like I said, it's nice to know that it's preventable, because there's some controllable risk factors that we all have in anything we do, but more so particularly with this when we're talking about high blood pressure, smoking, etc.
Right. There's things that we can't do anything about: our age, our ethnicity, our family history, but there are things that we can do something about, and the most important is blood pressure, having ideal blood pressure control, and that's normal blood pressure, less than 120/80, and not smoking if you do, having blood sugar that's well controlled, cholesterol that's well controlled, getting an adequate amount of exercise, and having a normal body weight.
Now let's go back again, because I think it's important for our African American community, the blacks community, particularly overall risk of stroke for that particular group is the highest, right?
It is the highest.
Why so?
Well, there's a accumulation of risk factors. It's not just that each risk factor carries this much weight and that's it. It's when you have more than one, it's not just what we consider a linear increase in the risk. It's actually exponential. So to have diabetes and hypertension is far more powerful than the risk associated with high blood pressure and diabetes separately.
Gotcha. Interesting. The statistics, 77 of studies shown 77% of black women and 63% of black men aged 20 and older are overweight and obese. So again, those are one of those controllable factors that with smoking, high cholesterol, lack of physical, etc., those one of those things that we have control over that we could prevent strokes down the road.
That's right. And access to care in some communities is inferior, or the seeking of health care is not what it should be. And then adherence to medications when they're prescribed.
Now, with the stroke, we hear, we talk about heart attacks, But with strokes, truly every second counts. Is that correct?
Every second counts. At the moment that there's a disruption in blood flow, brain cells start dying. It's estimated that about 2 million brain cells will die every single minute during a stroke. And because stroke is treatable, every minute counts. If we can get you to an emergency department that's capable of treating you and get you worked up quickly and get the clot-busting drug into you, and then it works, we can significantly reduce the severity of the stroke. And sometimes reverse it completely.
Right.
But every minute there's less and less proportion of brain tissue that could be saved if we're able to get the blood vessel open.
So the warning signs, and we're going to go to this really simple thing, it's a great thing to remember, but the warning signs are sudden numbness or weakness in the face, sudden confusion, sudden trouble seeing others in one or both eyes, and sudden or severe headaches that with no really cause for the reason for that, correct?
That's right. About 50% of people who have a stroke will have unilateral weakness, meaning weakness that affects one half of the body, and it might be the whole side. Sometimes it's just the face and the arm. Sometimes
right
it's just
side
the leg.
usually? Doesn't matter. Okay. Now there's something we all can do, which I think is great. It's called FAST. Tell us about that. I love it.
FAST is an acronym for face, arm, speech, and time. And so if you are concerned that somebody might be having a stroke, ask them to smile and see if there's asymmetry to their smile. If their face is symmetric, then that's not affected. But that's a pretty significant
because people often say that they feel like they can see that one side of the face is drooping, correct?
That's right. Now, some people have a normal asymmetry, a very mild asymmetry, and we'll have to check their driver's license or something like that to see whether that's just how they're made. And
you'd
some
really
people
have to be on your feet to think of that, but yeah.
Some people are a little bit crooked in their smile.
Right.
And some conditions can cause facial drooping that doesn't have anything to do with the brain tissue
but
itself.
Still get it checked.
Absolutely. And then the A stands for arm, so to have the patient or the person hold out their arms and see if one arm drifts down relative to the other. The other one is speech. Ask them to repeat a simple phrase back to you and see if, number one, they understood the command, were able to produce the output, and whether it sounds slurred or whether it's nice and crisp and clear.
Good. And then the last one is time, which we talked about. Because the first thing you need to do, if you're with two people, first off, send the other person to call 911, and then you can start going through these steps.
That's right.
Which are so critical. And the nice part about it, as we said earlier, is that they can be controlled and they largely can be preventable, which is, I think, fantastic. We're talking about time. It is so crucial with this. You were saying when you get to the hospital to get the necessary drugs in there, how quickly that's not universal for one person as it is for the other.
Well, not all hospitals are made the same, but the most important factor is to call 911. Don't think you're going to expedite things by putting grandma in your car. Because when you call 911, the EMS system comes out and the technicians evaluate you. They say, I think this patient's having a stroke, and they will take you to a stroke center because they're required to take you to the closest appropriate facility. And we do have several primary stroke centers in our area. The other things that they do are, they have vital signs, they can run some heart rhythm. And
dispatch that ahead.
They get an IV in place, and when they show up, they have a team waiting for them. So in our hospital, we know often 10, 15 minutes ahead of time that we have a patient with a presumed stroke coming in. We're waiting for them.
And as you had said, what is really important is we have come such a long way in our understanding of what a stroke truly is from what it was many years ago, correct?
Well, many years ago, there was very limited treatment. It was essentially an aspirin and rehab, and now we have much more that can be done. We have the clot-busting drug. It's still the only proven treatment to improve outcome after development of a stroke, and it needs to be given in the first few hours to be effective. But there are some advanced therapies, many of which we offer in our center, that we apply to certain patients in certain circumstances based on what blood vessels are blocked and how long it's been, and how much damage we think that the patient's already accrued on their imaging.
And there's a lot of great information that the American Heart Association has that's out there that if someone is interested, they can go. Is that typically where you send people to?
Absolutely. You can go to the American Heart Association's website and get all types of information about your risk factors, how to control them, the symptoms and signs of stroke, what hospitals to go to.
And the nice part about it too is that, you know, because there's also called mini strokes too.
I hate that phrase.
I'm sorry. I've heard that. And is that
it's
just the severity
phrase.
of a stroke, right? Or
some people use that term for what we call minor strokes,
right.
which are non-disabling strokes.
Okay.
And some people use that phrase for TIA, which is an entirely different thing. Okay. TIA is transient ischemic attack. It's, in my opinion, an almost stroke. It's an opportunity to say, something's not right here that caused these symptoms. What can we do to prevent it from recurring and then persisting if it recurs?
Well, it's a lot of information. It's great information. I would recommend everybody to get yourself familiar with FAST. Again, face, arm, speech time, critical. Get someone to call 911. Again, really simple to do because starting the process is first. And of course, we've got a great website. Let's show everybody wherever you need to go. Again, for more information, go to powertoendstroke.org for more information. Good resource, a lot of different links to other sites of information. So please go there, get yourself aware of what's going on. It is the month of May, National Stroke Month. We really would like to have no National Stroke Month going forward, just if we can educate ourselves and again, do those critical things that we can and have control of ourselves. Smoking, cholesterol, blood pressure, eating right, obesity, etc. Those are the things that we can all do something about and get yourself educated and get yourself familiar with what's out there and how to react.
That's right. Live prepared, not scared.
Love that stuff. You should be in this seat. You're doing such a good job, Sheryl. All right, everybody. Thank you so much, Ms. Sheryl Martin-Schild at the Vascular Neurologist at Tulane University Health Science Center. Thank you so much for coming on again.
Thank you.
Great information and continued success for you, and thanks for all the great work that you do. All right, everybody. That wraps it up for this segment of Cox Connections. We'll see you next time. Thanks for watching.